So PRP, or platelet rich plasma, is a technique and procedure where we draw a patient's blood, spin it down, harvest out the region or portion of the plasma that is rich in platelets. Those platelets carry all of the healing growth factors for remodeling and repairing tissue. So by concentrating them and having a very small volume, we can inject them back into the body to promote tissue recovery, remodel. We can treat many conditions from arthritis to ligament, acute or chronic ligament injury, tendon injuries, whether it's tendonitis, chronic tendinopathy, where we have chronic degeneration and partial tearing. In some settings, even with near complete tearing, we can inject those platelets into that region and promote the scar tissue, early scar tissue formation that can then help turn into very similar structure to normal tendon as well. PRP can also be used in muscle injury, whether partial tear, chronic strain, and pretty much any tissue in the body, including things like plantar fasciitis. PRP can be used around nerves, but really is best used in the setting of other musculoskeletal conditions.
Yeah, and I'd say the PRP is really good as a upper mid-level care for like someone with an injury. So we do a lot of pickleball or tennis injuries, golf, basketball injuries, where we can help the healing process, like hamstrings or knees or stuff like that as well. Dr. Marno, I would like to explain the advanced PRP tubes we're using.
Certainly.
Talk about those a little bit. Yeah.
Certainly. So the PRP kit that we're using from Care PRP really allows us to use a much smaller volume of blood, as 25 milliliters of blood as opposed to 50 or more milliliters of blood. With this particular kit, we're able to concentrate and get a much larger volume of platelets, higher number and better concentration of it, without over-concentrating the platelets as well. Over-concentration of platelets can actually be harmful, but really the advantage of this is also being able to use a single kit as opposed to requiring multiple kits, because PRP can be with or without white blood cells. And white blood cells are great for helping remodel those tissues outside of the joint, like a chronic muscle or tendon injury, where macrophages will actually help remove the bad tissue, and the platelets will actually help restore and remodel the tissue. However, inside of joints, leukocytes are very harmful and will actually break down the cartilage inside of the joint. So the nice thing is, with having a single kit, we can decide in the moment, depending on where we're injecting, whether we need those leukocytes or white blood cells or not.
Yeah, one point I want to double up on that is the advanced tubes we use for advanced care. Like a lot of times you're getting insurance-based PRP, which is it seldom happens. What happens now, it's poor care. And what we've learned over all the years is simply that not everyone should use PRP. I think a lot of older clients we get will say we've tried PRP quite a bit, but it's not always an end all. At the age of 40, we're very cautious about should we add components to the PRP to make it more effective, because when people are hitting 50, 60, or 70, the blood is just old. There's no way around that. So we often combine advanced lab work with that to see if the client is even a good candidate for simple PRP or advanced PRP, or how many sessions that they might actually need.
Yes, much like our red blood cells, our platelets are only as healthy as our body is. Yeah. And as we age, toxins, everything that builds up in our body over the course of time, those can actually be harmful or less effective, for sure.
Yeah, just something for the common viewer to know, that not all PRP is created equal, and there are some factors that might not even make it productive at all.